here and hear some of the things that are important to us, right? Which is worker mental health. I will not introduce myself because I think Veronica already shared my background. Just sorts of we'll start with some disclosures. Part of my faculty effort is funded by the T42 at the COSI Center here, which is one of the 18 centers funded by the CDC NIOSH. In this talk, I will share a case exemplar. And this case, the study in this case exemplar was funded by the Blue Cross Blue Shield of Michigan Foundation. And lastly, the content of this presentation are my sole responsibility and do not necessarily represent the official views of the CDC, the Department of Health and Human Services, nor the Blue Cross Blue Shield of Michigan Foundation. Although I am presenting by myself, I do have a good group of collaborators who actually keep the work moving forward and make the work fun for me. My research assistants, my PhD student, and other collaborators who are continuing to support this important work. By the end of this talk today, what I hope for you to take home in your knowledge bank is those four components, right? First, hopefully you'll be able to describe the current state of worker mental health and its prevalence as a public health and occupational health priority. Two, being able to discuss the individual and organizational consequences of unaddressed mental health concerns among workers. Three, being able to identify the multifacets, right? Interpersonal, organizational, and systemic factors that contribute to mental health disparities among workers, particularly among those who are marginalized. And then lastly, being able to formulate at least one actionable evidence-informed step that you can take as a current or future occupational health professional to promote mental health equity in the workplace. Mental health is a major public health concern. Mental illness is defined as a non-substance or developmental associated mental, behavioral, or emotional disorder that can range from no impact to a severe impact on daily life. Serious mental illness is a mental illness that entails serious function impairment, interfering with life activities. An example of these serious mental illnesses include schizophrenia, bipolar disorder, and eating disorder. And we know that mental illness is a leading cause of disability worldwide. Now, let's think about the mental health as a major burden, right? In 2022, there was an estimated 59.3 million adults. Now, that is 23% in the US had a mental illness. And the prevalence is specifically high among young adults ages 18 to 25 and those who identify it as white, as well as those who who selected two or more races. Mental illness, especially when untreated, directly contributes to suicide, which is one of the leading causes of death in the US. And we know that it is very costly for us, right? With a 282 billion cost, right? Economic cost as of 2024. We also are aware that there are certain groups who are disproportionately affected by the burden of mental illness. And these are some of the groups that are listed. We're looking at racial and ethnic minorities, sexual minorities, individuals experiencing homelessness, right? The unhoused, and those involved in the justice system, as well as those living in the rural areas. Now, why worker mental health matters, right? So the data that I provided, some of those statistical points that I provided were for the general population, right? And social determinants of health, which is a buzzword, right, that we all keep hearing over time, over the years. These are conditions in which people are born, grow, work, and live and age, right? And the wider set of forces and systems shaping the conditions of daily life. We spend majority of our awake time at work. So of course it makes sense for work to be at the core of anything that we're looking at when we're focusing on promoting one's health and well-being, particularly their mental health. Yet it has taken us so long to acknowledge that work has to be a key social determinant of health. The literature is showing that one's well-being is directly influenced by how their individual characteristics intersect with the social and structural factors, and the workplace remains at the core of those structural factors. Workplace mental health, right? So across the US workforce, um, missed work due to mental health absences cost, again, very costly, approximately $47.6 billion annually. And we see that 76% of US workers reported at least one mental health condition symptom, and 84% said that their workplace conditions had contributed to at least one mental health challenge. 81% of workers stated that they'll be looking for workplaces that support mental health in the future. And we know that many mental illnesses are protected under the ADA, the American with Disability Act. But of course, right, there are always loopholes, and we want to make sure that we capture everybody. Based on over 15,000 responses from US working adults, we see that women under the age of 30 really experience the greatest burden of poor mental health. And we see that as we get older, the gender gap in mental health disparities actually start to narrow. And when asked about the impact of work on their mental health over the last 6 months, we see that about 40% of the responders said that their job negatively impacted their mental health. And we see that across the various age group, the younger adults reported that their jobs had negative impacts on their mental health, right? And interestingly enough, we see that those who are 65 and older report the opposite, right? And it in my mind, I'm thinking that those individuals who are older, and specifically looking at the more affluent individuals, right? We as we get older, we tend to end up doing the work that we're actually are interested in, that we love. And also, the older you get, the more opportunities you may be able to get to be in more leadership positions, in managerial positions, etc. Right? And then, of course, I say that with the caveat that it all depends on the individual social demographic profile, right? Because not when you take a look at racial and ethnic minorities, based on their age group and the work that they do and their industries that they work in, that's not necessarily the case. From this report, we also see that 33% of workers noted not knowing whether their employer provided access to mental health support services, and also 24% reported that such services are not provided. Now, this is disconcerting, right? Because given the data that we saw earlier, with over 59 million individuals in the US having mental health issues, and having a large number of workers in the country having mental health concerns. And for the workers not to know whether the employers provide mental health service support, and also for the organizations not to provide such support, that's not necessarily a good thing. So this is where I would like for everybody to get engaged, if possible, if everybody can pull out their phone. And I believe Veronica will also put the link in the chat, as well as the number if you do not have the ability to do the QR code. To your mind, what are some organizational factors that can increase the risk for poor worker mental health?
You can also feel free to include responses in the chat and I can add them.
And I can't see how many people, so unless somebody put something in the chat.
Yeah, if for some reason you're not able to go on the QR code or the link, no worries. Feel free to include your response in the chat and I can include it in the link.
Let me make sure. Oh, they're coming. I hope everybody can see the word cloud that is happening right now.
Yes, we can see it.
Great. This is awesome. Yes. Organizational factors that are increasing the risk for poor worker health, right? So we see, so support is getting pretty big here. I saw bullying and then it's decreasing. Lack of support, leadership, customer service roles, retaliation, job insecurity. This is beautiful. You guys did the work for me. Thank you. And of course, let's see. Oh yeah, see, and interestingly enough, leadership support continues to remain at the center here. Toxicity, workplace toxicity. Great. Shift work. Wonderful. So feel free to continue building this. So I want to download this beautiful word cloud here. Um, very, very nice. Breaks. So let me thank you all for this input, and you all are right on the money, right? So these are definitely key factors um, that are directly related to worker mental health. Now, of course, many of you guys already identified these, right? So, and this word cloud actually captured the content of the next slide because we're talking about three approaches, right? Mental health outcomes are shaped across levels, right? Both at the interpersonal level, and we're talking about supervisory support, which many of you highlighted in the word cloud, team culture, right? All those things matter really deeply. At the organizational level, we're looking at staffing models, right? Scheduling. Some of you mentioned shift work in the word cloud, access to benefits, right? These really play a crucial role in somebody's well-being. And then we're looking at the systemic level. Um, I'm pretty sure many of you have seen this iceberg picture here, where if you just look at the issue at the very top, oh my, yeah, at the very top here, if that's all that you are targeting, you are essentially missing the big picture here, right? This is when we're talking about root cause, systemic issues, right? Structural issues. This is the important part where you really need to target. And we see in this picture, this part is bigger than the top, right? So scraping at the surface, yes, you can do that, but this will continue to exist. So at the systemic level, right, looking at labor policies and worker protections, right, exposures, right, all the any interventions that are put in place need to actually operate across all these layers in order to really, really promote worker health and well-being. We start seeing a shift in the conversation about psychosocial stress at work in the mid 1990s, right? Where scholars started to make a connection between work stress and morbidity and mortality. And looking at the person fit model, this model proposes that worker health and stress are shaped by the degree of alignment, right, or fit between the individual, the worker, and their work environment. So at its core, the model is stressing that when there is a mismatch between the person, right, the worker's ability to do their jobs, right, effectively, really is impacted by their capacity and their work structure. This model really calls for a good alignment between the individuals, right? The individual's ability, the individual's capacity, and their work environment. And when we're talking about workplace structure, we're talking about um, if the workplace fails to meet important needs such as fair pay, right? Many of you guys talked about wages in the word cloud, recognition, right? If somebody feels like they're not valued at the workplace, autonomy, safety, support, all of that, right? Interactions between the coworkers, supervisory support, all of that, all of those factors really impact somebody's psychosocial, psychological well-being. Another framework that really touches upon that is the Karasek model. And this model focuses on job strain, right? So basically, this model suggests that if you look at the four quadrants here, right? Ah, okay, great. So somebody who's at a job where they have high demands, right? And they have low decision latitude, right? Like low control, for example, of control over their work hours. They will end up in this quadrant and that will lead to high strain. And this is where you don't want your workers to be, right? And high strains, right, leads to not only physical illness, right? There's a plethora of literature that shows that high job strains actually correlates with cardiovascular diseases, right? Hypertension, etc. But also psychosocial strain, right? Poor mental health, burnout, etc. Here's another model. And this effort reward imbalance model by Seagrease really talks about the amount of effort that the worker perceives that they're putting in. If they feel like it doesn't match the perceived reward that they believe that they deserve, and the reward doesn't have to only be financial, right? It could be feeling valued, right? Being recognized for the work that they do, where the supervisor shows that they care for their health and well-being. If there is an imbalance between the effort and the reward, then we will end up with psychological strain and poor health outcome. So we're talking about who are most at risk, right? So mental health risk patterns, um, so mental health is really influenced by structural inequities, which is what we've been saying so far, right? So workers who are in precarious employment, for example, individuals who are in temporary roles, low wage sectors often have less autonomy and fewer benefits. Occupational segregation and discrimination, right? Really together compound these exposures. So if we're not applying an equity lens, then we are really reinforcing this disparity. I know the first speaker a couple of weeks ago, Dr. Jun, provided some extensive description of the various issues that low-wage workers experience, so I will not expand on that. In their paper published in The Lancet, so Frick and colleagues actually provided this conceptual framework on the social determinants driving one's health and well-being. And it goes from the socioeconomic, and political conditions, right? One social position and employment condition, and how together, right, all of these conditions together really leads to health inequality and negatively impact the worker well-being. At the individual level, right? So we talked about those stressors. Now, let's talk about the consequences. At the individual level, if unaddressed, right, workplace stress can contribute to psychosocial, right, and physiological dysregulation, right? So we're looking at the human body, nothing is working right, right? We talked about cardiovascular risk, right? Your brain, lack of sleep, inflammation. Then we transition to how it spills out of your body, right, in your brain, and transition into your family, your community, and also behavioral concerns as well, right? Some individuals have poor coping mechanisms, right? They go into, substance misuse, right, and disengagement. And really, emotional exhaustion increases the risk for workplace injury, right? So it's a cycle. So the workplace is not conducive to the person's health and well-being. And then based on how the body is reacting and how the person is reacting in terms of their behavioral coping, then it goes back into the workplace, right? So they tend to make more hours, and when they're at work, and increasing the risk for illnesses and injuries, right? At the organizational level, right, from an organizational perspective, unaddressed mental health challenges include decrease in money, right? So there's losses in profits here. You have increased employee absenteeism, which means the person just doesn't come to work, right? They're calling in, they are not feeling well. Um, Turnover, right? People quitting, right? And worker presenteeism, right? Where the person is so fatigued and so tired and really not mentally feeling well, they come to work, but they can't focus, right? So they're just sitting there, they're not processing anything, they're not moving any work forward, so they're not being productive at work. And then also really impacts the workplace culture, right? The poor work organizational culture where people are not enjoying coming to work. They really are not loving their job. And unfortunately, many organizations often underestimate the financial cost of poor mental health um, in their especially to their bottom line until it's too late. To make sure I'm doing good on time. Okay, great. So I wanted to present this work that I've been doing. So to date, I have been working with low-wage workers, specifically service workers, and hotel workers have been one of the representative groups that I work with. Hotel workers as well as nail salon workers and home care workers. I just went backwards. So I'm going to do something a little bit different here. I will go ahead and tell you what we found in the study, and then I'll go backwards and then do the background and then the methods for the study. So basically, the goal of the project was to actually understand work challenges, right? The added work pressure, access to care, and look, I'm missing an L, and the mental health among hotel workers, right? And so we surveyed among about 518 hotel workers in the state of Michigan. And of those 518 individuals, 215 were guest room attendants. And guest room attendants sometimes are referred to as hotel maids, housekeepers, room cleaners. And the literature continues to show us, and my research as well continues to show us that these worker groups tend to be at higher risk for poor health. And um, and this study actually shows also that they are experiencing worse mental health compared to the other hotel worker groups. So, for example, the guest room attendants in this study were 2.7 times more likely to screen positive for PTSD symptoms compared to those who are in the other jobs categories. And they were more likely to report that they didn't have access to a primary care provider. They were also more likely to have difficulty with modes of transportation to access a primary care provider. The guest room attendants were also more likely to rely on state insurance and low premium plans, and more likely to receive care at local health centers and free clinics, right? They worked there in terms of work-related pressure. The guest room attendants were more likely to report working extra hours, um, experience wage theft, right? Loss of pay, difficulty coordinating childcare. And now across the whole 518 samples, we found that working extra hours significantly was associated with depressive symptoms. And across the whole 518 hotel worker sample participants, we found that individuals who reported working extra hours were 2 times more likely to screen positive for PTSD. Now, in terms of anxiety symptoms, those who are focused on using um, employer-based insurance actually fared better with anxiety symptoms compared to those who were relying on state-based insurance. And also those who reported walking to healthcare appointments experienced more anxiety symptoms. So I shared with you some of the key results that were really significant to our minds, right? Myself and my research team members. Now, going backwards, right, with the background. So both every time I talk about hospitality and tourism, and I talk about hotel workers, it's important for us to really have a visual about who we're talking about. So the terms tourism and hospitality are often used together or even interchangeably. However, there are some overlap. The Despite the fact that there's some overlap, these two terms do not necessarily refer to the same work environment or worker task or exposures, right? So when we're talking about hospitality, we see that there are many sectors such as tourism and travel, accommodation and food and beverage, right, and recreation. And we see that tourism refers to travel outside of one's normal environment, including international travels, cruises, and casinos. And the food and beverage sector includes restaurants, catering, bars, and cafes. Recreation entertainment center includes attraction such as museums, parks, and sports. And lastly, we have the accommodation, right, which I have circled in red here. The accommodation sector pertains to lodging and to temporary stay. This sector includes hotels, motels, beds and breakfasts, timeshare, right? Airbnbs would fall under there, resorts, etc. So when all the sectors are put together, one can agree that the definition of hospitality as the business of helping people feel welcomed and relaxed and to enjoy themselves, right? We can see the premise behind the thought. So when I am talking about individuals in hospitality and accommodation, especially for the study, I was referring to those who fell under accommodation, that specific sector here. Worker profile, 8.3 million workers are 8.3 individuals are employed in the accommodation industry, right? And we see them across the US. They contribute to the economic well-being of the country, right? Contributing to the GDP, really contributing to the federal, state, and local taxes, and also the spending, right? The hotel guests spend over 548 billions, right? Close to $600 billion. So let's take a look at the workers. So in the results of the study, I really emphasize on the guest room attendants, and you'll see why. So when you're looking at accommodation and you're looking at hotel or motel, let's say you've stayed at a hotel. When you come in, of course, you meet the manager, for example, you meet the front desk, right? So you also have your food services, right? You have those individuals who do the laundry, right? Some hotels or some organizations have bell, right? Individuals who bring in your luggage to your room. So these are the various job categories. And we see that the guest room attendants, who are fairly a young group, right? They are primarily women, right? They are often of racial and ethnic minorities and really falling below the minimum wage. When we're talking about hotel workers, we're looking at different exposures, right? And specifically for this talk, we're talking about mental health. So I highlighted the psychosocial stress, right? So in terms of workplace exposures, we see physical and ergonomics, right? We see chemicals, we see the biological exposures, right? And the psychosocial. Specifically for the guest room attendants, right? They are a group of workers who work alone, they work in isolation, right? They work at fast pace. For example, some hotels may provide an individual 18 room quota, right? I've interviewed workers who mentioned they've done 30, right? So there's no standard in terms of room quota they can complete in a given shift. So there's this work pressure, right? There's this lack of control over their work hours, right? Again, they work in isolation and they experience workplace bullying, right, and discrimination, and of course, low job security, right? So all of these factors can really give us a picture of the potential health risk, mental health risk that these worker groups can be facing. So just by looking at some of these pictures, we can see what's going on, right? There's a lot of bending, kneeling, twisting, reaching, right? Of course, the repetition. So really, this is a group that's really dealing with a lot of physical injuries, but we have not spent a lot of time looking at their mental health and well-being. And this was why this study was so important. Until recently, little attention had been given to the psychological trauma, right, caused by sexual harassment among guest room attendants. So, uh, the Me Too movement, for example, had provided a platform for a closer look at sexual harassment among low-wage workers, right? And for organization to be more proactive in protecting the safety of their workers, including hotel housekeepers. So this timeline I developed here I wanted to take a look at the evolution of the standards, right? To really protect specifically the guest room attendants from experiencing uh, sexual harassment, right? And we see that in some states have done more than others, right? And now, when I talk to workers, sometimes the report is that, okay, they're provided a panic button, right? So they have a device on their persons and they're cleaning a room, and a guest walks in and they feel unsafe. They have this device that they would press. Now, not everybody has a follow-through process, right? So the worker presses the button, but then who responds and what does the response process look like? And also we can understand that given the organizational bottom line, how does that work? Because this industry is an industry that thrives on customer loyalty, right? So similar to travel ban, if somebody misbehave on an airline, they may say, okay, the airline may say this person is no longer able to fly on this flight. So I am not aware of the the hotel or accommodation industry actually having a system like that, because of course that would lead to more customer loss. So this was my conceptual framework guiding this work, right? And I continue to rework this conceptual framework. So if you look at this image here, the worker is at the center, right? And similar, so as if you're a nurse and you're on this call, we really emphasize patient-centered care, right? So you look at the person, and then the care is provided based on what surrounded the person, right? A holistic approach. And that's the same way that I developed this framework, where okay, you have the individual worker, what all the things around that person, right, that are really driving their, in this case, mental health and well-being, right? So you look at policies and system, right? Let's say if the worker is somebody who was a foreign-born individual, for example, right? So looking at the immigration policies currently, right? Social support, social identity, right? Where the person fits in there, as well as their work, right? Looking at the work design, right? The type of industry, looking at the organizational policies, all of those things have an effect. And then that leads to, right, we talk about coping, right? And then ultimately, the person ends up not doing well mentally, not doing well physically. They're not reporting to work, right? So the work outcome here, looking at work productivity, which is looking at both absenteeism and presenteeism. And then you look at accelerated aging, right? Your body's aging faster, right? And premature death, right? So you're dying earlier than you should, because of all these factors that are impacting your health and well-being here. So for this study, what we did was, so the work that I do is anchored into a community-based participatory approach, where we work together with individuals within the community. So we developed a community advisory board, which comprised of hotel workers, union reps. Okay, so we use the literature, of course, to develop a draft of the survey. Then we met with the CAB and they shred apart the survey, right? They said, you need to add this, you need to add that, this doesn't make sense. And then once we finalized that survey, we went through an institutional review board at the University of Michigan, and to make sure that the study protocol was sound. And then we proceeded to recruit the participants. And once the individuals were recruited, they completed a survey. That's the report that the study, the survey that survey results that I shared were from that, the 518 individuals. And then we also interviewed a subgroup of individuals. I did not report on the interview findings here. In terms of measures, specifically for mental health, of course, it was a very comprehensive survey where we included other measures, but for the purpose of this talk, we really highlighted depression. We use the patient health questionnaire, which is the PHQ-9, a 9-item questionnaire, right? Which was scored on a 4-point Likert scale, not at all, from none at all to nearly every day. And then we also use the general anxiety disorder scale, which is the GAD-7, which is a 7-item instrument. And then we also looked at the PC post-traumatic stress 5 scale to capture PTSD. And then in terms of the added work pressure, participants were asked about their experience with right, customer service, the customers that they engage with, right, the safety of their working conditions, their staffing, right, working extra hours, right? Childcare coordination. And then in terms of healthcare access, we ask about source of insurance, whether they had access to a primary care provider, and then also transportation to primary care provider. So these were the measures that we used to capture the data. Now, in terms of implication from what I just presented, right, we can see that mental health disparities, that it's really structural, right? It's rooted in so many things, right? Wage instability, caregiving strain, right? Constrained with healthcare access, right? And importantly, that policy, clinical, and organizational support really need to foster access and promote mental health services, particularly among those specific hotel worker groups. Now, what can be done? Right? I don't know if you guys have seen those two figure here. So we have one, which is the hierarchy or control, right? Which is the staple hazard control that was developed by NIOSH, and it really goes from top to bottom, from the top being the most effective way of control, right? And then to the bottom, which is the PPE, which is the least effective. And then when we transition to the Total Worker Health Initiative, which really calls for a more integrated look of the worker health and the worker's health, right? Because the hierarchy of control for the first version was really just looking at the workplace exposure. The Total Worker Health Initiative really talks about looking at the person holistically, right? Also in their workplace and all those external factors, right? Looking at their social demographic profile, for example. So specifically for mental health. So when somebody takes a look at this figure here, this figure, right? Um, if you're talking about asbestos exposures, for example, or lead exposure, then you could easily determine how to address those, right? PPE, right? You do masks, you do gloves, for example, all of those. But specifically for mental health, how would you address those, right? So for PPE, which is the least effective, right, based on in this pyramid here, we have things that can be done in terms of employee assistance programs, right? Stretch management, mindfulness, right? Um, mindfulness training. Oh, I lost my, oh, there you go. And then resilience training, right? For the administrative control, right, which is the next step up, really looking at your work hours, right? Are you providing regular breaks for the workers? Mental health training for the leaders, for managers and supervisors. Are they able to identify workers who are in distress, right? And then are they providing a culture, a safe culture where people actually can express their needs if they're struggling. Engineering control, right? Really looking at your staffing ratio, not having people being overburdened, overworked. Workflow design, using effective scheduling software, right? Providing a physical environment that is conducive to stress reduction. So some people thrive in dimmer lights, right? Noise control, all of those things. For substitution, replacing the current model, right? If the shift work scheduling is not working, if possible, right? Because that's not feasible to do that for all industries. Really replacing how we're operating as an organization, right? From communication to the culture of the workplace. And this may also require staff change for elimination, right? Actually taking away the sources of stress, such as mandatory overtime, right? In the case study that I showed, right? Working extra hours was a source of stress, right? Eliminating unrealistic expectations for the workers to really, really help them not feel stressed and overburdened. Now, this is the framework proposed by the US Surgeon Generals, right? And this framework provides a practical roadmap for employers to create environments where workers can thrive, right? Not only physically, but also mentally, right? Which is what we're here for. So based on this figure, this model here, right? We see first the workplace needs to have those five cores, right? Protection from harm, really providing the workers a safe working environment, physically and psychologically, right? And that includes fair treatment, manageable workload, clear expectations, right? Mirroring what we just talked about for the pyramid. Addressing discrimination, burnout, right? When we're looking at the connection and community, what type of workplace culture are you fostering, right? Are you providing a culture where there's supportive relationship between the coworkers, right? Where this sense of power, where you're scared of your supervisor, the supervisor is disconnected from the workers. All of these things matter. Having work-life harmony, right? Are the workers able to, when you hear the term work-life conflict, how are you able to meet the responsibilities outside of your work, and whether your actually work is impinging on your ability to address those outside demands such as caregiving, right? Mattering at work. Do you feel valued, right? Does the job feel like you're just a body, right? That if you leave or if you quit, or that you're easily replaceable, right? Um, are the workers feeling invincible? Not invincible, invisible, right? And opportunities for growth, right? A lot of the jobs, the person doesn't have an opportunity to see, okay, can I move up the ladder, right? And this does take a toll on the person's mental health and well-being. Now, a call to action for us here, all on this call, right? There are several things that can be done, right? So, evidence-informed programs. There are already programs that are in existence. For example, my colleague, Leslie Hammer in Oregon, has a great program where they're actually training supervisors on matters of mental health, right? To be, for the supervisors to recognize employees in distress, to actually have a sound workplace where they actually are providing existing mental health programs to support the workers, right? Looking at peer support model, trauma-informed workplace framework, right? And I just shared the information about, sexual assault, right? What is happening in the workplace to support those workers who may have experienced such um, horrible things, right? Having flexible scheduling at the organizational cultural leadership level, right? Um, I being able to identify psychosocial stressors, right? Having establishing anti-bullying policy, right? Leadership accountability, transparent communication. And then again, looking at the bottom of the iceberg, right? Looking at labor laws, looking at paid leave policy, worker protection standards, right? It is so important to move from this reactive model that we've been living in so long, right, to being proactive, right? Preventative approach. What are we doing to prevent people from getting to where they are right now mentally, right? And that does not necessarily involve money, of course. All those programs would require some type of financial support, but you can start small, right? Policy reviews, supervisor education, right? And really thinking about what can we do as researchers, clinicians, academicians, right? Health professionals, what can we do, right? But what we know for a fact that is that programs alone are not enough, right? If those programs, right, they're not enough if the organizational culture does not foster or support psychological safety, right? That's important. All right, we're almost done. One more input here. True or false? In order to promote mental health equity in the workplace, at the individual level approach is needed rather than a population level focus. Similar to what you did before, you can go ahead and do scan the QR code at the top right corner. Or I think also Veronica will put the link and the text information. Okay, so in the interest of time, I'll just keep going. But yes, everybody's correct, right? So this individual approach we just heard, right, is not enough, right? We need to go at the root cause, and the approach needs to be multifaceted. All right, how did we do? So anytime that I have learner's objective, I always go back to see, okay, did we address all the key components that you were supposed to take in your learning bank here, right? So first, we talked about the current state of worker mental health and why it's important, right? We talked about what would happen if mental health, right, remains unaddressed, both at the individual level and organizational level. We talked about the interpersonal organizational and systemic factors, right, that contribute to mental health disparities. And we talked about quite a bit of some steps, right, that are evidence-based that can be taken to promote mental health equity in the workplace. Um, we know that worker mental health is central to occupational health and well-being, right? And we know that this, disparities are driven by all these factors. And thinking about this is the correct space for us to start thinking about how we can address those, and where we as clinicians and individuals in those various spaces where we occupy, how we can create critical change, right? We can be critical change agents, and really understanding that when we're talking about mental health, workplace mental health, it's not an individual resilience issue, right? It's it's a organizational, it's a systemic issue, and we need to really address it from all corners. All right, I will stop here. Thank you for your time and active engagement.
Thank you so much, Dr. Rosenberg. That was amazing. We really appreciate you sharing your wealth of knowledge with us. So now we have time for some questions. So we're going to give it a couple of minutes here to see if anyone has any questions that they'd like to pose in the chat or through the Q&A feature. We'll wait here. If not, we'll chat a little more about your work, Dr. Rosenberg, which is so important. We have some comments in the chat saying thank you for the presentation, amazing presentation. Okay, we have a question from Alejandra. Can you please say more about the role of the union in supporting workers and improving working conditions?
Oh, thank you for this question, Alejandra. So, it all depends on who you're talking to, right? So, I will openly say that I am not speaking for saying, I'm pro-union or against union, right? So, let's make this clear. What I want to say is what the data have shown me, right? So, I have collaborated with the local union, and I have reviewed bargaining contracts, right? And from what I see is, for example, for the hotel workers, when somebody is affiliated with the union, for example, in the bargaining contract based on the institution, they may have a cap where the union and the bargaining contract with the institution say you cannot have a guest room attendant clean more than 15 rooms, right? Versus if somebody who is not affiliated with the union and so they don't have a protective contract, then they may be assigned more than 15. Does that make sense? Um, so this is what I have seen, and also people who are affiliated with unions, for example, if there's unfair working conditions, they tend to feel like they have a more um, a safe space to go and share the concerns, right? The wage issue, right? They may have the space to in the contract to talk about, okay, this is how much the person should be paid versus somebody who's not affiliated with the union. Did that answer your question?
Alejandra says, thanks. I noticed that worker voice is in the middle of the Surgeon General framework, and unions are such a powerful way to have that. I know research supports better conditions.
Yeah, yeah. And I had to make that statement because my goal is to actually be a partner, right? I want to partner with organizations to promote worker health, right? And not all organizations see a benefit in having union, workers or affiliated with the union. So I always say, let me go back to see what the data are showing me, right? Who's looking better and what are considering everything equal, what's that one factor that keeps coming up that shows that if we move that a little bit, we may see a change. Thank you.
Great. Thank you so much. Alejandra also added, makes sense that more worker power translates to better conditions. Definitely. All right, let's see if we have any other questions in the Q&A feature or in the chat. Feel free to add.
And oh yeah, my email address, I can put it in the chat too. If anybody has any further questions, I am happy to share any references or links or anything like that that people would like to follow up on.
Great. Thank you so much for being willing to share that with everybody. I'll put it there too.
Thank you, everybody.
I have a question.
Yes, yes, yes.
What would you say are best practices as far as workers bringing up, mental health conditions to their employers? Because I've been involved in worker training, and I think that's been one of the hardest issues, bringing up how to implement controls for that and just not being taken as seriously about mental health issues. So, in your experience, what's been some of the best practices to do that?
Thank you for that question, Veronica. So I will share what I have seen in the work that I've done with nurses who've experienced workplace violence, right? Some type of workplace injury. And I have interviewed hospital leaders, for example, and EAP program directors. So there is a mix of what works, and it will depend on the culture of the workplace, right? So some people have an anonymous, right, space where somebody could just report, right, where they don't have to self-identify. I've seen instances where there's a peer group where the leader, the manager is not necessarily in the group, where they meet, right? Group of nurses would meet every morning for that peer group and they share things. And then there's a spokesperson then who would then connect with the leader and share things that are not, and sort of like not water it down, but in an aggregate format. And then there's also if the person is struggling mentally, for example, having programs available and having resources, right? So for example, here there are phone numbers, there are um, email, there are contact information. I mean, some people may not feel comfortable receiving service from their their place of employment, right? But what you want to do is provide them that option to say, if I don't want to use the workplace service, what other options do I have?
Great, thank you.
Yeah.
Another question in the chat from Alejandra. Curious if you looked at whether workers filed workers' compensation claims for work-related mental health issues, and if so, how effective the care was and whether it was covered by the employer's insurance.
That is a great question, and I wish I could answer that, right? And I think that is something worth looking into, right? So the challenging thing with workers' comp is they want to, it's hard to directly relate certain things directly to the workplace, right? So if you are in the workplace and something falls on you, or you actually have a severe injury, it's clear, right? Even people who develop chronic conditions, right? It's challenging for them to say, okay, you've been exposed to this thing constantly, right? And we're talking about mental health or chronic stress exposure. And then over time, you end up developing this issue, for example. It's hard, it's challenging for you to say, well, this was directly related to the workplace. That's what we're trying to do, right? Yeah, that's a great question. I'll look into it anyway.
Thank you so much for that question.
Thank you.
Right, we'll wait a little bit more here just in case anybody does have any other questions, since we do have a little bit more time left. But the time being, I am going to put the evaluation link in the chat.
Alejandra, I would love to continue this conversation with you, so please reach out.
Yes, definitely. We'll connect you too. Great. See if there are no more questions, then I'm just a little bit curious. I always ask this question, I feel like, of our presenters. How did you get into this work, Dr. Rosenberg?
Oh my goodness, I love this question though. I love this question. So, um, people, have you ever heard of the word me search? So basically, where they say, researchers often do something that is of interest to them because they have some type of a personal connection in some shape or form, right? So I was always interested in worker health and safety. I was always interested in research from undergrad anyway, but um, and especially my focus on low wage workers, my focus on service workers is because I'm an immigrant myself, right? And seeing how experiences differ based on how people perceive somebody, right? And how opportunities may change, and how one's health, I mean, literally, um, it's a matter of life or death, right? And that really relates to your workplace, um, personal experiences of family and friends who have been in service industries in low wage jobs, right? These are constant motivation of mine. And then to get me started. And then now that I'm in the data, I see those things. It's putting more fire, right? Yeah.
Amazing. Well, we are so glad that you're in this line of work. And thank you again for sharing your research. It's been amazing to hear everything that you've been able to accomplish. So thank you everybody that joined. Again, I will be sending out a follow-up email with the slides as well as a link to the evaluation.